Citizen Action wants to make sure that everyone is aware of the most effective way to talk healthcare possible. Too often, we speak about the specifics of our pet project, and in doing so, we lose people. And between Walker's cuts to Badger Care, Paul Ryan's efforts to slash Medicare and Medicaid, and the GOP presidential candidate's goal to repeal the Affordable Care Act, health will certainly be an issue in the very near future. First, our healthcare principles. These principles express fundamental American value. First is that healthcare freedom must be restored. Medical decisions should be controlled by patients in consultation with their healthcare providers, without interference from insurance companies. 2. Everyone should have health security, which means a place to go to purchase quality, affordable coverage. Americans think health insurance should be there when they need it. 3. Healthcare discrimination by insurance companies is a violation of fundamental rights, especially against those with pre-existing conditions, and it must be outlawed. The pre-existing condition issue pops. It is one of the most unpopular things out there. And it's a bureaucracy word, just trying to hide the fact that it meant that someone has been or is sick. But it is such a horrible practice with so many horror stories that people know what this word means. And if there is such thing as a real death panel, it is pre-existing condition discrimination. People hate it, they think it's un-American. Most know people in their networks who are affected by it. We need to make this issue central to everything we talk about. The Affordable Care Act requires members of Congress to buy the same plan offered to everybody else in the new marketplace. This is the second most popular thing about the Affordable Care Act. First, because most people don't like Congress. And second, it's kind of a common sense logic we don't always think about. People figure that if Congress is going to take it, it must be pretty good. Preventative care with no cost sharing. It is extremely important for getting costs under control, both for private insurance and for those on Medicare. Furthermore, most people understand that. It makes sense if you think about it. Most people want to know where they come out in the plan, and the more we talk complex details and statistics, the less they know where they stand. But parts like preventative care, where everyone knows deep down that the procedures such as cancer screenings are much cheaper than chemotherapy. People understand that preventative care makes people healthier and saves us money long term. This goes a very long way in making sure that healthcare is much more affordable for our country. This then is our message. The Affordable Care Act is worth protecting. It guarantees healthcare freedom. You get the ability to control your healthcare. Everyone will have the peace of mind of knowing that they and their families have guaranteed access to affordable coverage options, no matter what. It increases opportunity. Think about it. Groups currently being constrained by health insurance barriers to access include groups like entrepreneurs. There are plenty of people who are stuck in large companies right now who ideally would love to leave it, but they can't because they're worried about how they'll be able to pay for health insurance. Farmers have an incredible hard time getting health insurance, so do many pastors. These groups buy their insurance on their own and as such are at the mercy of the market. Wisconsin should work to improve the new law by implementing it in a way that works for everyone, not special interests such as the health insurance industry. Our message then should be pretty clear. Why should we go back to a world where, say, Congressman Ryan doesn't have the same health care that you and I have, back to where he gets special treatment? Why should we go back to a world where those with pre-existing conditions can face discrimination, where women are treated differently, and where preventative care is not a priority to keep health care costs down? This is the world that we would be going back to if we tried to step back from the Affordable Care Act.